As part of the response to the unprecedented COVID-19 pandemic crisis, the United States Congress passed the American Rescue Plan Act of 2021, more commonly referred to as the American Rescue Plan. Signed into law in March 2021, the $1.9 trillion economic stimulus bill served to accelerate the United States recovery from both the economic and health effects of the pandemic. At the Georgia State Office of Rural Health in Cordele, Georgia, the Georgia Farmworker Program helped facilitate those appropriated funds to clinics and organizations in need across rural Georgia. Tiffany Harden serves as director of the Georgia Farmworker Program, alongside Tina Register in the role of Program Operations Specialist. Located 94 miles south of Cordele is the Georgia Farmworker Health Clinic in Bainbridge, Georgia. This clinic was a beneficiary of funding provided by the American Rescue Plan, and funding was utilized to expand the facility's capacity. Sheila Raymer, seen here on the right, is a nurse practitioner who serves as program director at the Georgia Farmworker Health Clinic. Tanya Cox, on the left, works as a RN for the clinic. Both Sheila and Tanya have seen great benefits to their clinic as a result of the American Rescue Plan.
When we were awarded the money for the ARP project, our main goal was to expand our clinic into an area where we could serve people to give the COVID vaccine and or test people in multiples. Our clinic's rather small, doesn't allow for a lot of people to be in the clinic at one time, and allow for social distancing and mass vaccinations.
I was just going to add to one of the things that we did already purchase that's very beneficial for our clinic is 2 temp stable refrigerators and a temp stable freezer. That way if the power was to go out, we could transfer them over here to these refrigerator and freezer, and they would be stable for 6 and 7 days without power.
Even with all the benefits seen from the funding so far, the Bainbridge Clinic still plans to purchase vehicles to accommodate patients for easier and more efficient access to health care. Sheila and Tanya highlight the important relationship between the Georgia Farmworker Health Clinic and the Georgia SORH office, and discuss future plans specific to the ARP funding.
Well, we get a lot of support. I know Tiffany is always, and Tina are always looking for ways to help build our program, help us to obtain the things we need. I was talking to Tiffany the other day and telling her just how much I appreciate all the work she puts in, because I know it's a lot of work to get these grants, get this money. Yes. Because before the first COVID grants, we weren't able to get any new vehicles. We had put a motor in one of our old 90-something vans, and the transmission went out in one, and air conditioners constantly. So you're constantly putting money in, but the base grant will not allow us to purchase vehicles. So we've gotten 2 nice vans, and that was with the ECT grant, and we got an Explorer, and we're just hoping to add 2 more and get rid of some of the antiquated, constantly breaking down equipment that we have.
One of the ones we're looking to purchase is actually a cargo van that'll have built-in shelving so that we can haul other things like tents, medications, and things like that.
Tables, chairs, all the things you need when you're out in the field and you're not here.
Thanks for joining us today. For more information on all the great work provided by the Farmworker Health Program at the Georgia State Office of Rural Health, please visit us on the web at dch.georgia.gov.